Welcome to the series Vitamins for Whole Health, short lessons on the vitamins that keep our bodies functioning optimally. I'm Thomas Lemke, registered dietitian and the clinical director of Whole Health. This installment is about vitamin B1, also called thiamine. What is vitamin B1? It is a water-soluble molecule known as thiamine found in food. Water-soluble means it mixes easily in water rather than in fats. Thiamine is absorbed in the small intestine as long as it makes it through a potential gauntlet of obstacles to get there intact. We'll discuss those shortly. Thiamine is necessary for the conversion of carbohydrates into energy, especially within the nervous system. Interestingly, megadoses of this vitamin are being studied for use in Huntington's disease. It's a neurological condition that leads to paralysis, and it's having very positive results in studies. It also helps give other vitamins like vitamin K and folate a longer lifespan in your body by participating in recycling them. Thiamine is necessary for your body to detoxify cellular waste products that can build up and make your body sluggish. It's also used to make fats, cholesterol, and other organic molecules that your body needs to function its best. Now, according to the University of Harvard, although symptoms of thiamine deficiency were first recorded in ancient texts of Chinese medicine, the symptoms were not connected with diet until the late 19th century. In 1884, a Japanese physician noticed very high rates of illness and death among Japanese sailors eating a limited diet of only rice for months while at sea. When given a more varied diet with whole grains, meats, beans, and vegetables, rates of illness and death nearly disappeared. Around the same time, two Dutch scientists observed that chickens fed white, polished rice developed leg paralysis, whereas chickens fed brown, unpolished rice did not. Their observations led to the discovery of thiamine present in the outer layers of rice that were removed with polishing. Now, thiamine was the first group B vitamin, and there are several, to be isolated, and the second vitamin overall to be isolated, the first being, of course, vitamin A. Yes, we do go in alphabetical order. Without adequate thiamine, you might experience the following: poor appetite, pathologies of the extremities related to nerve deterioration, eyelid twitching or drooping, speaking of nerve deterioration, elevated heart rate, feelings of weakness, confusion, and or apathy, and of course memory issues. When severe thiamine deficiency only affects your hands, feet, and heart, it's called beriberi, so named because of the population it was somewhat discovered in when they also were given polished rice with the bran or the hull of the rice removed. And when they developed the deficiency, beriberi was the word in the native tongue, Swahili, if I recall correctly, for I can't, hence the name of the disease. Now, when it affects eye muscles or your control over the bigger movements you make in your day-to-day life, it's called Wernicke's encephalopathy. You'll see this coinciding quite frequently, or not infrequently, maybe we should say, with cases of alcohol abuse. When it affects your mind, it is called Korsakoff's psychosis. Now, obviously, most of these can also be the result of other conditions as well, so talk to your doctor if you have concerns. How much thiamine do I need? Well, if you are a man, the recommended daily allowance is 1.2 milligrams per day. If you are a woman, 1.1 milligrams per day will keep you out of a deficiency state. More is okay, as we'll talk about shortly. Where can you find thiamine? As was mentioned, in whole grains, especially the bran or whole of the grain, and even fortified grains. So you polish some rice, and that thiamine in most American rice is added back in the form of fortification or enrichment, maybe better said. Legumes like lentils, beans, and peas also contain thiamine, very similar to their grain cousins. Nutritional yeast, wonderful source of thiamine. Up to you if that's the way you want to go. Meats do contain thiamine, pork most of all, but it does depend upon how it's farmed because it depends on the status of thiamine in the tissue of the animal in question, whether or not it's going to be available in that tissue when you consume it. There are also assorted vegetables that contain some trace amounts of thiamine, things like acorn squash, okra, sweet potatoes, mushrooms. An online search can give you a bigger and maybe even exhaustive list. And what are the obstacles to getting enough thiamine? Well, in the first place, thiamine is somewhat heat sensitive. It is destroyed by high heat and a long cook time, so heat over a long period of time. Eating raw fish can sap your supply due to the thiaminase enzyme present in raw fish. It's also present in some teas, shellfish, and clams, but developing a thiamine deficiency from consuming these foods is incredibly rare. Sulfites in food or produced by gut microbes can also prevent you from absorbing the thiamine that you need, and an unhealthy intestinal microbiome, which of course can in its own right be affected by medications, as too can it be affected by the foods that you eat, can also worsen your GI tract's ability to absorb that thiamine that you provide to it. So, who is at risk for a thiamine deficiency? Well, in the first place, those affected by anorexia. And this is a chicken and the egg phenomenon. If you remember from earlier, low appetite can be a symptom of thiamine deficiency. Low intake from low appetite can result in low thiamine, which worsens appetite in a kind of decaying spiral. Now, of course, older adults are also at risk as their GI tracts are not as good at absorbing nutrients, antibiotic use, which again affects your intestinal microbiome and can take the thiamine away in its own right with its own pathways, is a risk factor as well. Now, you see a lot of all three of these in populations that are inpatient in the hospital. A lot of older adults on antibiotics who are not eating very well. Very, very big risk there of thiamine deficiency. In my previous clinical career, I did make regular use of thiamine supplementation for individuals with low appetite simply because it's not really effective to test in terms of cost affordability versus the supplement itself is very, very cheap and very, very low risk to give somebody. And I was able to see a lot of patients in these demographics improve their appetite on thiamine supplementation. HIV/AIDS also at risk then of thiamine deficiency. Individuals on fat diets, which may not be getting the thiamine in the diet that they need. Of course, as was mentioned, alcoholism or other liver disease can impact thiamine status. It is not stored well in the body, and as a water-soluble molecule, again, washes out fairly quickly. What little gets stored often ends up in the liver, and when liver disease happens, even that little bit can be gone. That keeps it in the body's pool in between meals. GI disorders, particularly of the stomach or small intestine, can also affect this. Now, do consider that those who have had bariatric surgery also fall into this category and are at risk along these lines because of alterations to GI function. And of course, lastly, those who are diabetic that may be on drugs such as metformin. And of course, there's other reasons somebody might be on metformin as well. It's being increasingly prescribed for PCOS and other conditions. So that can cause an induced thiamine deficiency, something to look out for. As far as toxicity of thiamine, again, it is a water-soluble molecule and thus easily flushed from our bodies via the urine. Hence, there is no known thiamine toxicity. Now, there may be some crazy people who are doing mega doses of thiamine, which in the future months and years, we may see with a thiamine toxicity, maybe get written about in some kind of a paper. But otherwise, at standard doses, no such thing as a thiamine toxicity. Thank you for viewing the Vitamin B1 installment of Vitamins for Whole Health. We'll see you around.